Welcome to another hour of Experts on Call on News Talk 580 CFRA. Get expert advice on a variety of topics. Ask questions, get answers.
And a good afternoon to you once again. Experts on Call on 580 CFRA continues with another informative hour and a key one for optimum health. This hour, we're going to look into something that will be of interest to virtually all males, regardless of age demographic. This hour, we welcome back Dr. Hassan Sanufi. He's from La Vie Health for vital information on men's health and testosterone this hour. Good afternoon, Dr. Hassan.
Hello, good afternoon. How are you?
Nice to see. Fine, thank you. Nice to see you again in this gorgeous sunshine this afternoon. And to new listeners, we've already had a series of health-focused shows over the past few months with Dr. Hassan Sanufi, covering a wide range of topics. This one for the guys. Now, in previous shows, Dr. Sanufi, we've talked about men's health generally, but certainly this is unique, and we're going to get into the specific topic shortly. But to begin, how about a little history on La Vie Health and maybe an update on your brand new downtown location?
Thank you very much. So basically, we opened our first clinic in 2007.
Mm-hmm.
So it's 11 years now.
Wow.
And the first clinic is still running, up and running. It's based at the Brook Street Hotel in Canada.
Okay.
And then from there, we found that there's a high demand to open a second clinic, more so for the downtown core area. So we have opened our second clinic now. It is located at 275 Slater. It's an amazing location, Slater and Kent, and it's on the main floor. And we're very proud to say that the clinic is gorgeous. It looks great. It's more like a state-of-the-art facility.
Now, what about size-wise? How does it compare to your Canada location?
It's identical in size.
Okay.
We have several exam rooms. We have a lot of diagnostic abilities in that clinic, and we have amazing staff as well.
Now, this is pretty handy for downtown workers, perhaps government folks, or, any level of worker who's busy, in the downtown core, but they need some specific issues addressed from a health standpoint.
And diplomats as well, yeah.
Absolutely. And diplomats, exactly. We're going to get into that shortly, too. This is a great service and a great opportunity for diplomats that are new to our country, visiting on work assignments to stay healthy. Everybody has to stay healthy, that's for sure.
That's true.
So the mission, I guess you could say, of La Vie Health is optimum health and proactive in nature.
That's true. So our main mission is early detection, prevention, and reverse aging. That's how I would like to say it,
Wow.
Yeah.
That covers a lot of ground, and the listeners probably saying, well, what does that mean? Well, a lot of it means that while you're healthy, while you're feeling really good, that's the time to come in for the checkups.
Absolutely. So let's go back and talk about the reverse aging part, because I'm sure that a lot of listeners are thinking, oh, what does he mean by reverse aging? I truly believe over the course of my experience as a physician, let me say more like a proactive approach physician. I always felt that it's not enough to diagnose disease. It's not enough to tell patients that you're at risk of cardiovascular disease or something. It's very important to also to look at any early signs of aging and try to reverse them. And it's a very simple concept. It's all about identifying any deficiencies in the body and optimizing those deficiencies and let the body heal itself. That's the concept of anti-aging, basically.
Now, the deficiencies, what form could that take? Could it be maybe a drop in certain elements of blood work, or what does it include, or what would it include?
It does include, actually, it's a combination of a few factors.
Okay.
One, obviously, is a detailed blood work analysis to analyze a lot of ingredient or nutrient in the body and see if there's any of them is deficient. For instance, like vitamin D, B12, folic acid, different minerals, as well as hormones. Plus, obviously, look at the cholesterol, the blood sugar, liver function, all of those,
So basically, if there was a deficiency in one of those many areas that you're talking about, and they're coupled with perhaps another deficiency in another area, that could lead to a specific type of aging.
That's true, because what happens as we age, our body the function of aging is your body starts declining in terms of secreting certain hormones,
Okay.
certain enzymes,
Mm-hmm.
and the capability of your body to repair itself it starts to drop down. And if we were to identify those elements that, and it could be unique from one person to another based on age group, different exposures, different illnesses, and so. So once we identify those, in my opinion, once we start replacing all the deficiencies that the body might have and optimizing them, not just replacing them, then the body one of a sudden has the capability back to start repairing those damaged cells and repair itself.
So if a person, or a potential patient or a patient comes in and they perceive to be healthy, they feel good, they don't have any particular issues, I guess on that first visit, then that becomes their specific benchmark for how other things could progress over the years. Could that be?
That's true. If you feel that you have no symptoms, that doesn't always translate into that you're not brewing any disease.
Exactly.
In fact, in my opinion, and that's from my experience over the course of 15 years now,
Right.
what I've been noticing, and it's a medical fact anyway, there is a lag between the onset of illness, any illness, you name it, like hypertension, diabetes, low testosterone, cancer, different stuff. There's a lag between the onset of the disease and the onset of the symptoms. It could be like sometimes a decade. So the winning strategy is to identify any, as early as possible, any signs of disease, and then reverse it right away. Not to wait until one of a sudden you start having developing symptoms, and now you start seeking medical attention.
So that lag time in between, it could be perhaps the body doing what it can to try and fight it.
Yes, compensatory mechanism. That's absolutely true.
But then it just gets to a point where it can't fight it anymore, and then that's when it.
You got it, Dave. The body will say, enough is enough. I can't compensate anymore. And now you start developing symptoms.
Okay. Very, very interesting. Now, this is certainly, health issues are important for men and women. And Levi has programs and special different kinds of programs for individuals or organizations. And we mentioned before diplomats. Maybe we could touch on a few of those programs before we go to break, because I know we want to get into our discussion on testosterone this hour.
Absolutely. So, you know what? We have several core programs.
Okay.
The main core value that we have is the comprehensive wellness assessments that we provide.
Okay.
It's very proactive. It's the objective of it is early detection, prevention, and reverse aging.
Mm-hmm.
So it starts with a thorough and detailed blood work that is specific to age and gender,
Okay.
as well as a very detailed questionnaire that we provide patients with that they need to fill out. And it's a very comprehensive questionnaire about different aspects of their health and their family history as well. And then we conduct different baseline testing like hearing test, vision test, heart tracing, ECG,
Okay.
breathing test, pulmonary function test, body composition analysis for fat, the percentage of body fat, and muscle mass, segmental muscle mass. And then after this part, once this is done, it gets reviewed by a panel of experts.
Mm-hmm.
And then once it's reviewed, we decide if there are any further tests needs to be added even before seeing the patient. And then the phase 2, when the patient have the first interaction with the physician.
Okay.
During this phase 2, it's really a 2-hour assessment. And the patient tend to spend literally 2 hours with the physician. So they have an ample amount of time to discuss all of their concerns, an ample amount of time for the physician to address all of the concerns from the physician's perspective as well about their health, and conduct a very thorough medical exam. And again, the objective of the exam is not a reactive medical exam. It's more like a proactive medical exam, looking for any signs or clues of any potential illnesses, and then addressing them.
That's why it's so important, if you feel good, to go for your baseline benchmark checkup anyway, and use that as your place to start.
I can't say it enough. It's really, really important.
Yeah, absolutely.
Like I said, don't wait until you start having symptoms.
Yep, absolutely. Men's health issues certainly a topic of conversation has been in the past with Dr. Sanofi, and we're going to touch on it again, and we're going to bring testosterone into the conversation as well when we come back on News Talk 580 CFRA. Experts on Call is the program. And again, Dr. Hassan Sanofi, he's the founder of La Vie Health on Leggett Drive in Canada and now at 275 Slater Street in Ottawa, 2 locations. We'll be right back on Experts on Call on News Talk 580 CFRA.
We'll return with more Experts on Call on News Talk 580 CFRA. Now back to Experts on Call on News Talk 580 CFRA.
Interesting conversation this hour. We're chatting with Dr. Hassan Sanofi. He's the founder of La Vie Health on Leggett Drive in Canada, and now also second location downtown at 275 Slater Street, just freshly opened, and looking forward to welcoming you. Before the break, we were talking about the comprehensive wellness assessment, Dr. Hassan. Perhaps you can carry on that. We kind of got cut off midstream there.
So, yeah, we were saying that this assessment really takes 4 hours to finish.
Okay.
One of the key elements of this assessment is the fact that every patient will end up spending 2 hours, literally 2 hours, with a physician, which is a very valuable time.
Yeah.
During these 2 hours, a lot of health issues will be addressed, and as well as a lot of a very detailed, comprehensive physical exam will be carried on, keeping in mind that the objective of this assessment is early detection, prevention, and also reverse aging. So at the end result of this assessment, we provide every single patient with a very detailed action plan, where they are at and what needs to be done next to make sure that they're healthy and as well as to reverse the disease.
Now, would there be follow-ups, I'm thinking maybe 6 months or a year later or 2 years later, to see how things have progressed or not, based on their individual plan?
Thank you for asking this question. So usually what happens, once we provide the patient with a detailed action plan, which could include refer to different specialists, imaging studies, more further blood work to be done, or maybe a repeat blood work in 3 months to reassess, we carry on with that action plan. So we make sure that all of those items of the action plan has been fulfilled.
Okay.
And in fact, that's when the actual assessment is concluded. So it really doesn't end at 4 hours, you know. It's not just a 4 hour assessment. It ends literally after everything has been fulfilled and all of the criteria of the action plan have been met.
Wow. So
and sometimes it can take like 3 months, 6 months. It depends on the situation.
And of course, as you say, with everybody being different and everybody's situation unique, that plan that is developed is unique to each individual patient.
Yes, you're right. It is unique. It depends on what kind of symptoms they have, what we have identified based on the physical exam and the blood work, or the family history sometimes play a role.
Now, if the listener is looking for a quick reference to the phone number, what is the best number to call your office?
At this point, probably 613-592-0862.
Okay.
And also, our website is a great resource for our services, and it's laviehealth.com.
Perfect.
Yeah.
All right. Now, you folks have other services, too, that we should probably touch on. We were mentioning that a bit earlier in the show. Maybe you could highlight us there.
Yeah. So the other service that we have, which is another core service at our facility, at our both facilities, basically, it's the Point One Care program. Point One Care program is an amazing program for busy individuals and individuals who really care about their well-being and health.
Okay.
So this program is very proactive, very advanced, provide those patients expedited visits. So let's say if patient needs to be seen, we literally see them within 24 hours, and usually it's the same day, actually.
Okay.
And if they're sick during on the weekend or after hours, we make sure that they get seen promptly the same day.
Wow.
And also we make sure that we navigate the healthcare system for them. Let's say if they need any imaging studies or any referral to a specialist, we make sure that we get the shortest wait time anywhere in, you can say in Canada or even US sometimes. We refer certain patients to US to get some tests done if we cannot get it on a timely fashion in Canada. So basically we take control of their health and make sure that it's well managed.
So this is what they call the Point One Care program.
That's true. Yeah.
Now, can that information be found on the website?
Yes,
Okay.
indeed. So if someone were to go to our website, lavihealth.com, they will definitely find more details about this particular service.
Let's talk about men's health. We got to get into that. I'm really interested in this. Why? I guess this is such a general, universal question, but why is it perhaps that many men in almost all age groups tend to downplay the importance of regular checkups?
I think because they're wired differently.
Okay.
So I think women in general, they're more caring, they're more emotional, which is a great thing. It's a great complementary characteristic of women as compared to men.
Right.
Whereas men, because more so, I would say the hormone, the testosterone, we're wired differently. We're wired to work and downplay everything and all what we do in this life.
Just plow through
yes,
everything.
Exactly.
The things,
but you're right. It is a characteristic for men not to be to downplay symptoms or underestimate certain things in terms of their health as compared to women.
Well, sometimes certain health issues can't be avoided because sometimes scans or MRIs pick up things that are totally unexpected, and that's only because they've had perhaps a check for something else, and something else has been discovered.
Yeah,
At
right.
Saying, why? Well, where did this come from? Well, these things happen. That's what we're all about. But the things that men tend to forget, or at least put to the back burner, are things like blood pressure, cholesterol, and blood sugar checks. Those are the key things I think that all people, men and women, should be conscious of.
In my opinion, yes, these are core health issues: the blood pressure, the diabetes, the cholesterol. But it's far more beyond that, in my opinion. You have to make sure that you check other elements to make sure that a particular person is healthy.
Right.
As I mentioned earlier, it's very important to check all of your body ingredient because a lot of times, all what it takes, one deficiency, and you get a system like multi-system breakdown because our body works in harmony and synchrony. It does. It's like you don't have one organ or one cell, you can say even, that operates independently as compared to the rest of the body. We work in harmony and synchrony. So when one thing is broken, there's a cascade of events tend to happen. For instance, vitamin D deficiency can lead to multitude of symptoms, including we were planning to talk about testosterone, including testosterone problem.
Really? Now, just to digress for a second, vitamin D. So in other words, a little time in the sun isn't necessarily enough.
You see, the problem is, I think it's a misconception that if I always have a tan and I go to Florida every winter, then I should be perfectly fine in vitamin D. The objective of UV light is to convert inactive vitamin D to vitamin D3. But from my observation, based on lab tests and patients' history, I found that there are quite a few patients that they despite the exposure to sun exposure, they tend not to have the capability of converting inactive vitamin D to D3, vitamin D3. So that's why I think it's crucial to test vitamin D3 on every single patient, whether it's a child, a male adult, or a female adult.
Now, that would be part of a comprehensive check, I guess. Part of the blood work.
It's a must. We do that on all of our patients. And you would be surprised. You can see the most tanned patient, and who's doubting the test, questioning why you're doing vitamin D on me. And then he will be, a lot of times they get shocked. Oh my God, my vitamin D is really low. And I'm tanned. So they tend not to make this connection.
Are there different levels of need for men and women or for vitamin D, or are they both about the same?
I think there is a misconception about that. A lot of even healthcare professionals think, okay, 2,000 units a day is fine and you don't need even to check it. I have patients that they take 20,000 units a day and their vitamin D is barely elevated,
Really?
Within the normal range.
Wow.
So I think, in my opinion, the best clinical practice approach is to retest. Start certain dose, a baseline dose, and then retest and see if this dose is adequate because everybody's different.
Yeah, no kidding. All right.
And that's applicable, by the way, to everything.
Well, vitamin D is certainly something that is a requirement. We all need it, and I'm glad that you clarified that. And if you have any question about that, certainly, as you say, the assessments will address whatever the needs might happen to be for things like vitamin D.
That's correct.
Fantastic. All right, now testosterone. We have just a minute or so left, Dr. Sanufi, but I want to ask you, testosterone, is it a hormone? It is a hormone, I think.
Yes, but yes, of course, it's a hormone.
Okay.
The only misconception that we have, a lot of patients and some physicians, to a certain degree, they get fixated on the fact that testosterone is only a sex hormone. Basically erection libido. In fact, testosterone is far more than just a sex hormone, and I can elaborate on that after the break, I guess. Sure. Right?
Perfect. Absolutely. That sounds fine. Don't go away. We'll be right back.
Experts right here.
Absolutely. Experts on call on News Talk 580 CFRA. Dave Watts with you this hour, and Dr. Hassan Sanufi is our guest. He's the founder of La Vie Health on Leggett Drive in Canada and now on Slater in downtown Ottawa. We'll be right back.
We'll return with more Experts on Call on News Talk 580 CFRA. Now back to Experts on Call on News Talk 580 CFRA.
Dave Watts with you, and if you're just joining us this hour, a very interesting conversation. Our guest is Dr. Hassan Sanufi. He's the founder of La Vie Health. They're on Leggett Drive in Canada, a 525 Leggett Drive, actually, Suite 150 in Canada. And a brand new location just opened recently downtown here in Ottawa at 275 Slater. Main floor location. And Dr. Sanufi, these two locations are amply equipped to take care of specific needs for all of your patients.
That's true. Yeah.
And we're going to have to drop down and check out that Slater location very, very soon for sure.
It would be a pleasure.
Absolutely. Now, we were talking just before the break about testosterone, and you were saying that it's more than just a sex hormone. Perhaps you could elaborate on that.
Yes, Dave. So, they say that I think there was a book written, Men Came from Mars and Women Came from Venus.
Yeah.
I think that's absolutely true. And the truth about that is how men are wired compared to women. Men have testosterone receptors in every single cell of their body. It's in the heart, it's in the brain, in the muscles, in the gut, everywhere, you name it. Women, in the contrary, they have estrogen, progesterone, and testosterone. So they're lucky they have even the testosterone receptor everywhere in their body. But obviously the concentration of testosterone as compared to estrogen, progesterone, which are more main hormones, is different. And that's what drives emotion, beauty of women, which we're lucky that way, and the body shape, sexuality, the mental function, all of this.
Okay.
Now, going back to testosterone being more than just a sex hormone, when this testosterone starts to decline as a function of aging and exogenous exposure, meaning like different environmental exposures. And this could start as early as mid-30s.
Really?
Yes, absolutely. It's very important to look at the clues. There are like multitude of symptoms because of the wiring, like I said. And it's far more beyond erection libido and muscle mass. Those symptoms could be fatigue, depression, loss of interest and anxiety, memory loss, sudden rise in the blood pressure, insulin resistance, and rise in blood sugar and visceral body fat. It could be sleep disturbances, bone loss, high cholesterol, because testosterone, one of the functions of testosterone in terms of cholesterol, it activates something called reverse transfer of LDL, which is the bad cholesterol, outside of the lining of the artery and gets rid of the bad cholesterol, LDL. So again, it's really far more beyond just erection and libido. So a loss of the fact that some men that don't have the loss of erection and libido doesn't necessarily mean that their testosterone is perfectly normal. And obviously, testosterone, given the symptoms that I just elaborated on and described, it's critical in terms of aging. And it's a critical tool for anti-aging. So that's why testing for it and identifying any hints and symptoms it becomes critical.
How is testosterone affected, for example, say men that have had prostate cancer and they've had radiation, maybe a mid-level cancer or something, and Does testosterone take a hit with radiation? Does it need to be fixed, or how does that work?
The answer is I think it could vary from one person to another.
Okay.
Obviously, radiation is dangerous for the testicles in a way that can affect the function of the testicles where the testosterone gets produced, obviously.
Yeah.
And then it becomes critical for men with prostate cancer. And I want to say one more about prostate cancer.
Sure.
And I think I've said it before to you in our previous shows, I mean. So exposure to radiation obviously can affect the testosterone production, and it needs to be checked. Now, one of the challenges, there's a misconception among patients and some healthcare professionals that the reason for prostate cancer likely is testosterone induced. In fact, this is absolutely false. Because if you're aware of, I'm sure that you are, technically men tend to develop prostate cancer later in life when in reality the testosterone starts to decline and the estrogen starts to go up. So the etiology of prostate cancer is identical and similar to the etiology the cause of etiology, meaning the cause of breast cancer, which is it has something to do with the estrogen. It's aromatization of the testosterone into estrogen, and it's E1, which is the esterone level in the blood that can trigger prostate cancer. And clearly also family history of prostate cancer can increase your risk of prostate cancer. But the reason why men get prostate cancer is more so because of the esterone, which is form of estrogen, rather than the testosterone.
I see. All right, getting back to testosterone specifically, what might some symptoms be or clues to low testosterone level that an individual, a guy, might notice?
Yeah, I already said it, Dave, but I will say it again. It could be fatigue, just simple fatigue, depression, anxiety, memory loss, obviously loss of sex drive and libido, the erection strength, sudden rise in the blood sugar, visceral fat, meaning belly fat, bone loss, high cholesterol, high blood pressure, all of those. And obviously cognitive decline, memory.
Absolutely.
Poor handling of stress. A lot of men say, you know what, a few years back, I used to plug through work, I have so many meetings and I was able to manage. Now, all of a sudden, I can't handle the stress anymore.
Really? Wow.
So you need to look for the clues. But the more importantly is to look for the clues far beyond the classical erection, libido, and sex drive,
Exactly. Now, are there natural ways to raise testosterone? And I'm thinking maybe diet, perhaps, or whatever.
Yes. So let's talk about what happens in general as we age. As we age, naturally, testosterone can decline. The testosterone production from the testicles can decline. But also, there's another phenomena. There's a protein called sex-hormone binding globulin that starts to rise in the body, and this gets secreted from the liver. And what that protein does, it binds to free testosterone and decreases the testosterone level as we age, as well as aromatization, meaning conversion of our natural testosterone into estrogen, also starts to go up as we age. And as a result of these two factors, just simply by aging process, not any environmental other environmental issues, the testosterone starts to go down. But other acquired problem is obviously exposure to fake estrogen from the food and the industry that we have, plastic bottles, PBA product, and obviously animal products that we eat that are unfortunately not organic, that were fed with hormones to promote like growth in them, whether it's cattle's or poultry product or anything like that. So, which is a very challenging problem. As well as alcohol, definitely high alcohol intake can affect testosterone production. Obviously, obesity and liver disease, fatty liver problem can affect that. Zinc deficiency, vitamin D deficiency also can affect that. Zinc is critical for the metabolism and production of testosterone.
Do we generally get enough zinc in our diet, or do we need supplements usually, or how does that?
I think it could be different from one person to another. You have to test it to identify it, and also you need to look for clues of low zinc deficiency. Decline in testosterone, one of them, obviously, like I said earlier. hypopigmentation, white spots,
Yeah, yeah.
which or vitiligo.
Mm-hmm.
There's a problem where you get lack of pigmentation of the skin
True.
one of a sudden. This is another hint of zinc deficiency.
Really?
But also testing it is important. Check the level and see how close you are to the lower limit versus upper limit. And ideally, you want to be optimum. You want to be more like on the upper limit of normal rather than on lower limit of normal.
Absolutely. Well, that makes sense. Well, we're going to continue our conversation on testosterone, get into testosterone therapy ideas, and provide a little general discussion on that when we come back on News Talk 580 CFRA. The program is Experts on Call, and our guest this hour is Dr. Hassan Sanufi. He's the founder of La Vie Health. They have 2 locations in the Ottawa area, one in Canada on Liga Drive and one downtown at 275 Slater. We'll be right back.
We'll return with more Experts on Call on News Talk 580 CFRA. Now back to Experts on Call on News Talk 580 CFRA.
Dave Watts back with you, and our guest is Dr. Hassan Sanufi from La Vie Health in Canada and now downtown in Ottawa on Slater, 275 Slater. Before the break, Dr. Hassan, we were talking about a number of things, and during the break, visceral fat. And I think that's an element that is probably a bugaboo with a lot of guys. I think a lot of men are stuck with that, and that's essentially belly fat.
It's the belly fat. It's not the skin fat.
Okay.
Remember, I was saying
Yeah.
earlier. So it's not like when you pinch yourself and say, okay, yeah, I have a little bit of fat here, but I don't know why I have a belly. The belly, the reason why some men have belly, but not much of fat when they pinch the skin, is because this fat is between the organs, like between the liver and the gut. It's inside. And that's what's called, that's the worst fat that you can ever have.
So you can get rid of that through exercise and diet?
Exercise, lifestyle, yes, it's critical for
Diet. All right, getting back to our discussion on testosterone, we were talking about what it is and how it affects us, and testosterone therapy where needed. How can that be applied?
You know what? It's very important to have an experience in testosterone before starting testosterone therapy, because not every man in my practice ends up needing testosterone hormone. Some men require different therapy. I'm going to give you an example. Some men, the reason why they have low testosterone because of obstructive sleep apnea.
Okay.
So if you were to identify whether they have it or not, and then if they do, you were to correct the sleep apnea, they don't have any testosterone problem. So it's absolutely inappropriate and inaccurate to prescribe testosterone for those men. What you need to do, you need to correct the underlying cause. In their case, it's sleep apnea.
Okay.
So if you were to correct it, the testosterone starts to rise. And then, like I said, it's very important to have the experience, and as such, you need to do further tests beyond just the total and free testosterone, the hormones. You need to check the sex hormone binding globulin, the estrogen level, the FSH, LH, different hormones, and then identify what are the values of those. And sometimes all what you need is to stimulate the testicles to produce more testosterone rather than giving patients testosterone. So you need basically to identify at what level there's an impairment. Is it the brain not producing enough hormones that can signal the testicles to produce more testosterone, or the patient is producing enough testosterone but it's getting wasted by binding into sex hormone binding globulin and being converted into estrogen? So you need to identify which level is the problem and then fix that particular level rather than always giving everybody a prescription of testosterone. When it comes to testosterone therapy, the best therapy would be the testosterone injections.
Okay.
Because it goes through directly to the bloodstream. There's no transferability issue as compared to testosterone gel. The other way, obviously, is testosterone gel. The problem with testosterone gel, when you apply it, really you can transfer it to your partner. And the window of transference of testosterone to another partner by hugging, by skin-to-skin contact, is really far more beyond what it's documented in the product monograph, which says like 6 hours.
Wow.
I've had patients that went as far as like 12 hours, and there's still some transference when I tested the spouse. So that's the challenge with the gel. That's why the injections are better, and usually it's taken twice a week and specific dose. And usually the best approach is to go start low and go slow. So you start a small dose and then retest the testosterone, see what's the response to the low dose, and then you build it slowly to for the optimum level. The downside of injections, obviously, a lot of those are self-administered because it's a twice a week. You can't just run to the clinic twice a week.
Yeah.
It's inconvenience. So patients have to do those injections in the muscle themselves. And obviously, there's a learning curve. There's a pain involved because you need to inject yourself. So sometimes it's discouraging for certain men. Obviously, the alternative would be then the gel, but keeping in mind then the patient should be mindful of transference.
What about pill form? Is that available?
Pill form is available, but it's a very old practice, and it's no longer applicable, even though it's still because when you take the testosterone orally, it gets heavily metabolized by the liver. It can affect your liver function. Okay, so it's not that great for the liver. And also the end result or the bioavailability of the oral testosterone is very low.
Oh, okay. Okay.
So that's why it's not a popular practice.
Now, getting back to the injections that you mentioned, twice a week in some cases, how many weeks might be involved? I guess it depends on the patient, I suppose.
So yeah, I mean, of course.
Is it a long time? Like, is it a year? Is it for years?
It all depends on the situation. If
Okay.
if the loss of testosterone is secondary, meaning like as a result of other factors,
Okay.
we mentioned earlier, sleep apnea, or say high alcohol intake, high stress, and high cortisol from
Okay.
stress could be the cause of low testosterone.
Sure.
I think it all depends on fixing that secondary cause. Again, usually I would never start patients on testosterone if I were to identify a secondary cause, not just aging process and decline in the function of the testicles. So it's very important to correct these underlying cause first before introducing testosterone. So for those particular patients, if I were to identify a cause, I correct that first and follow them through. And if that's sufficient to restore their testosterone function or like testicular function, then that's fantastic. If not, then we start introducing testosterone afterward.
Does the therapy assist the development of natural testosterone?
Yes. Yeah, there's definitely forms of natural testosterone, and that's more preferable. The reason why, because it's more bioidentical to your body as compared to synthetic testosterone.
What happens with interruptions? Say, for example, a patient needs regular injections of testosterone, but they're traveling for business or whatever, and they're in the air frequently or traveling by car, whatever. I mean, routines get upset.
That's true. Then, I mean, you look at those patients, and then the alternative would be to introduce either the gel or compounded testosterone cream. You can do it also as a cream.
Oh, really?
Yeah.
Oh,
It's more compounded. I don't think it's available as a prescription, manufactured prescription, but it's more so like you compound it through a compounding pharmacy.
Dr. Sanufi, thank you so much. We're right out of time. Another interesting hour.
It was absolutely my pleasure, actually. I love to talk about men's health.
Absolutely. Well, good luck with your new location on Slater Street, and certainly continued success all around. Experts on call on News Talk 580 CFRA. Our guest this hour, Dr. Hassan Sanufi from La Vie Health, Leggett Drive in Canada and downtown on Slater. Thanks again, Dr. Sanufi.
Thank you very much.
News is next on 580 CFRA.